Hello friends, today we will discuss the treatment of syphilis. You know that syphilis is caused by a special type of a spirochete called Treponema pallidum, right? And it should be remembered that the Treponema pallidum thankfully remains very susceptible to penicillin G. So the drug of choice for syphilis is penicillin G. And in some cases, you can also give a drug called doxycycline as an alternative therapy. So let's talk about the stages of syphilis. See, syphilis is divided into three main stages. One is primary syphilis, or you can call it as localized primary syphilis. See, this stage of syphilis produces hard chancres, right? So, going to the second stage called secondary syphilis or disseminated secondary syphilis, which produces widespread maculopapular rashes. See, there is one more stage of syphilis called latent syphilis. See, this is the phase or this is the stage where disease enters into dormant or asymptomatic phase. Again, latent syphilis can be further divided into early latent syphilis and late latent syphilis. So going to the third stage, that is called tertiary syphilis or systemic tertiary syphilis. This stage of syphilis is going to affect your various organs like the heart and blood vessels, and it also affects your brain, your spinal cord, and the organs like the liver, joints, as well as testes. See, the point to be noted is when this syphilis is going to affect your heart and blood vessels, we call this syphilis as cardiovascular syphilis. And when the syphilis is affecting your brain as well as spinal cord, we call this type of syphilis as neurosyphilis, right? So now the question is, how do you treat these different stages of syphilis? Let's discuss that. See, for treatment purpose, in case of early syphilis, which includes like primary syphilis, secondary syphilis, and early latent syphilis, the drug of choice is a long-acting form of penicillin G. So what is that long-acting form of penicillin G? See, the long-acting form of penicillin G is called benzathine penicillin G. So a single dose of 2.4 million units of benzathine penicillin G is given through the intramuscular route, and this is the treatment for vast majority of the people. Alternatively, if a patient is allergic to penicillin or can't tolerate intramuscular penicillin, then a drug called doxycycline at a dose of 100 milligrams per oral is given twice a day for 2 weeks. Or there is another drug called ceftriaxone, which is given at a dose of 1 gram intramuscularly or intravenously for 10 to 14 days, right? This is all about how do you treat the early syphilis like primary syphilis, secondary syphilis, and early latent syphilis. Now let's talk about how do we treat late latent syphilis, tertiary syphilis excluding neurosyphilis, or syphilis of unknown duration. Let's talk about that. See, the treatment of these stages of syphilis like late latent syphilis, tertiary syphilis excluding neurosyphilis or syphilis of unknown duration, the treatment is same to early syphilis. It means we still use benzathine penicillin G, at a same dose of 2.4 million units and at a same route, that is intramuscular route. So everything is same, but the only difference is instead of a single dose, here in this case we use three doses separated by a week, right? So we give the first dose of 2.4 million units of benzathine penicillin G at first week, and again we repeat the same dose at a second week, followed by we repeat the same dose at a third week. So we give three doses separated by a week. And alternatively, if a patient can't tolerate penicillin for some reason, in this case, then we give a drug called doxycycline at a dose of 100 milligrams per oral twice a day for 28 days, right? Apart from all these different stages of syphilis, there is a special type of tertiary syphilis called neurosyphilis. So, how do you treat this neurosyphilis? For neurosyphilis, what we are going to be using is intravenous high dose penicillin G than regular doses of benzathine penicillin G. And that's because benzathine penicillin G cannot cross blood brain barrier. So we cannot give this drug to this type of syphilis. And now what we do is we remove this benzathine group and we give an high dose of IV penicillin. And this high dose may be around 18 to 24 million units of this drug, which is given through intravenous route daily. I mean, it is given around 3 to 4 million units of this drug intravenously for every 4 hours, and we use it for 10 to 14 days. So this entire course is maintained for 10 to 14 days, right? See, as the treatment for neurosyphilis is many times a day for many days, this often requires hospitalization and setup of home IV antibiotics. We can also give a drug like procaine penicillin G 2.4 million units intramuscularly daily, plus we can add a drug like probenecid 0.5 grams per oral 4 times a day for 10 to 14 days. See, probenecid blocks the renal excretion of penicillin and keeps the levels of penicillin high enough. But to get injections once a day for 10 to 14 days is very problematic and it is so painful for patients. Alternatively, we can also use a drug called ceftriaxone 2 grams intramuscularly or intravenously daily for 14 days. The pregnant patients with neurosyphilis should be treated as for non-pregnant patients. And let's assume, for example, they are allergic to penicillin. I'm sorry, they still need to take high dose IV penicillin and they can't take doxycycline. So the treatment would involve desensitizing these pregnant patients to this drug called penicillin so that you can use penicillin in these pregnant patients. Lastly, the penicillin therapy at all stages of syphilis can be complicated by the Jarisch-Herxheimer reaction. So it is very important to watch out for Jarisch-Herxheimer reaction, which is when spirochetes die and break open. So when these spirochetes break open, they release a lot of antigens, and these antigens, which are like foreign particles, can overdrive your immune system, and when your immune system gets overdriven, this results in having sudden fevers, sweating, muscles and joint pains that may last for few hours to few days. right? This is all about the treatment of syphilis.